Welcome. Thank you for joining us today. You are in the right place. If you are looking for a little bit of extra information about radon reduction, any questions that you had after getting your radon report back through the Radon 100 Radon Test Kit Challenge. So we'll give everybody a couple of moments to connect, and then we will launch right into our presentation. So we're running today's presentation in webinar mode, which means you should be able to see and hear us, the presenters, but we cannot see or hear you. That said, our goal today is to answer questions that you may have. We've received a number of questions ahead of time through the email that we sent out, but I do invite you also throughout the presentation, if a question comes to mind or a comment comes to mind, just pop it right into the chat. Using the chat or the Q&A function. I can't promise that we'll get to all the questions today, but we will do our best to answer them as we can, and then also in the follow-up email that goes out. Today's session is being recorded, and a recording will be sent to everyone who registered for this webinar and anyone else who is interested in having a copy. So one final note, if I can't imagine too many people are unfamiliar with Zoom at this point, but if you move your mouse around the screen, you should see a menu pop up, and that's where you'll find the buttons for Q&A and chat. And we do invite you to enter your questions or your comments there, just as we go through the presentation. So my name is Erin Curry. I'm with the Take Action on Radon team. I was very involved in running the 100 Radon Test Kit Challenge, so you may have seen me or seen my name in the past. And I'm joined today by three lovely radon experts who are all part of our team. So we will be starting today with Kelly Bush from Health Canada. And without further ado, I'll pass it over to you, Kelly.
Thanks, Erin, and hello, everyone. Good, mostly afternoon, I think, at this point in time. So good afternoon, everyone. I'm happy to be here with you today, and thank you for taking the time to join us. I'm speaking with you today from Ottawa, the traditional territory of the Anishinaabe, and I'm going to spend a little bit of time talking about what radon is and what the health risks are. So radon is a radioactive gas. It's formed from the breakdown of uranium in soil and rock in the ground. So all ground, everywhere in the Earth's crust, there is some amount of uranium, and as a result, there is some amount of radon gas. And radon gas is invisible to the senses. You cannot see it or smell it. And as a gas, it can move really easily from the ground and either escape outside where it gets diluted by mixing with the outdoor air, or find its way into enclosed spaces like homes and buildings where it can accumulate to high levels and become a health risk. One of the things I like to point out about radon, because radiation in general, because radon is a radioactive gas, and that's often missed. It's an indoor air quality issue, but it's also radioactive. And radiation is something that people know a little bit about. Some worry more about than others. And we're exposed to various types of radiation throughout our lives, both natural and man-made sources. And there are types that most people are more familiar with and concerned about, and those are nuclear power plants and weapons, as well as medical sources such as X-rays and CTs. But not a lot of people know about radon. And in fact, the sources that people are familiar with, the nuclear power plants and the medical sources, the exposure from those are very small, unlike radon. So it's estimated that our radon represents almost 50% of a person's lifetime radiation exposure. And that's why Take Action on Radon exists. That's why Health Canada has a national radon program. And that's why it's really important to know about radon and to take action to reduce your exposure to radon. So first of all, congratulations to everyone that's on this call, or anyone that listens to the recorded version of it, for stepping up and taking action and testing the radon level in your home as a first step. And so we can go to slide 2. And let's talk a little bit about, oh yes, I should have told you there's transitions on the slide. So there you go. Now it's colorless, odorless, and tasteless. A couple more times. There we go. And so health effects. Radon is recognized internationally. So it's not just Health Canada that's communicating these messages and encouraging action to reduce your radon exposure across the world. The World Health Organization, the US Environmental Protection Agency, and other authorities around the world are communicating the same message. It is recognized as the leading cause of lung cancer in non-smokers and the second leading cause after smoking. From a radon exposure perspective, the only known health risk associated with the exposure to higher levels of radon in indoor air is an increased risk of developing lung cancer. And the risk from radon exposure is long-term, not immediate, and it depends on a couple of things. First of all, the level of radon you're exposed to, how long you're exposed to it for, and your smoking habits. As a smoker, if you're also exposed to elevated radon levels, your risk of developing lung cancer is significantly increased. And so how does radon impact your health and your lungs? And you can see from the image there a little bit about what happens. What happens is the radon gas breaks down to form radioactive elements that can be inhaled into the lung tissue. And in the lungs, radon continues to break down. So it continues to break down, creating radioactive particles that release small bursts of energy. It's called alpha radiation that releases those bursts of energy. And this energy is absorbed by the nearby lung tissue, damaging that tissue and the DNA. And when cells are damaged, they have the potential to result in cancer when they are reproduced. So that's sort of how long-term radon exposure can lead to lung cancer. And we can go to the third slide. And so what you're seeing here is the most recent radon postcard that we have been distributing across Canada. So I mentioned earlier, we have a national radon program. We're doing a lot to get a better understanding of radon in Canada, what the risks are, what the best guidance is with regards to testing and reducing it. And we're trying to make sure Canadians know about radon because still today, too many don't. So one of the things we do to get the message to you in your homes is we mail out postcards every fall winter timeframe, which is sort of radon action season or radon action month. And this is the most recent postcard that was mailed out last November and January. And what it's communicating is about the risk from radon, that lung cancer is the most common cancer in Canada. The survival rate for lung cancer is low. It's less than 20%. And too often it's diagnosed late, and that's why the survival rate is so low. So if you don't smoke, quitting smoking is absolutely one of the most important first steps you can take in reducing your risk of lung cancer. But even when you smoke, or especially if you don't smoke, then radon is your biggest risk from a lung cancer perspective. And testing and reducing your radon exposure is the best way to reduce that risk of lung cancer for you and your family long term. So it's really prevention that we're talking about. And so that's what we're trying to communicate here, because there's not a lot of other things you can do. I mean, Dr. Anne-Marie Nickel will talk a little bit about radon or lung cancer screening, which is getting closer to different ways of preventing the risk long-term or diagnosing early. But right now, with regards to radon, one of the most important things that you can do is to test, and if the levels are high, to reduce it. So I'll stop there, and I'm happy to answer any questions that you might have.
Great. Thanks so much, Kelly. Okay, so we do have questions concerning basically the health impact of radon. Here's one. My son has some breathing issues since we moved into our house, and now we tested for radon and found out that our levels are above 400 becquerels per meter cubed. Are his breathing issues because of the radon in our house?
Likely no. No. So the risk from radon is not a respiratory issue, and we get this question quite often. And for me, it's really important that people understand what the health risk is from radon as it relates to lung cancer. and I explained earlier how radon can lead to lung cancer, and it's really a damage to cells, a damage to DNA that when they reproduce can lead to lung cancer. So it's not a respiratory issue. So if your son is having breathing issues, I would go and talk to your doctor and work towards figuring out what might be causing it or contributing to it. But it's not the radon exposure.
Okay, great. Thank you. So, building on that, another question we got was, how do I talk to my doctor about my past radon exposure?
Yeah, great. Again, another question that we get. I think you let them know if you've tested and you've found high levels in your home above the guideline level, then you let them know that you have tested, that you found high levels, what they were, how long you've lived in that home, and if they're not aware, and unfortunately not enough doctors are aware of the risk from radon, then point them to Health Canada and the resources that we have, but let them know it's a leading cause of lung cancer if you don't smoke, and you want them to consider that in the guidance and the health protection type work that they're doing with you as their patient.
Okay. Another question. What if my level is over 1,000 becquerels per meter cubed? How much risk am I at?
So if it's over 1,000, that's a significant level. So certainly you want to take action to reduce it as soon as you can. I mentioned earlier that the health risk from radon is long term. It's not immediate, so you have time. But the higher the level, the sooner that you want to take action. There is never a level where we would suggest you shouldn't live in your home or anything like that. Again, it's about testing and knowing the level and then reducing. And if you're concerned, though, understandably, there are some simple things that you can do until you can get a radon mitigation system installed. You can increase air exchanges or airflow in your home. You can open some windows, or if you have an air exchanger, you can run that. So all of those things will help reduce the radon level short term as well.
Great. Thank you. Okay, one final question that I have for now, but it's a bunch of questions put together.
Okay.
My reading was right around the 200 mark, and it is a basement room that my parents and in-laws, so older adults, stay in fairly frequently. It's also beside a small room that our whole family, children and adults, use regularly. So question one, how quickly should I be acting on this report? Is there a difference in risk for different ages? And is this reading indicative of the entire floor of the basement or just the room where it was placed?
Okay. So time frame, again, ultimately, the higher the level, the sooner you want to take action. We our guidance is within a year. If you can reduce the radon level, that is what we would recommend. So, and the fact that it's hovering around the guideline level, we get that a lot. The guideline level is a point where we recommend action. But it's really important to understand that there is no safe level of radiation exposure or radon exposure. So there is risk at 190, at 195, at 180. The risk is lower, certainly, but there continues to be risk. So ultimately, it's a decision that you need to make on how you prioritize um, health risks and health protection. With regards to age and exposure, any radiation exposure, including radon exposure, is cumulative over time. So the younger you are when you're exposed to higher levels of radon, longer term, you have more life to live to accumulate more exposure. So ultimately, that risk of potentially developing lung cancer is higher. So certainly, if you can lower your exposure when you're younger, you're reducing your risk long term of lung cancer. That's not to say if it's only elderly people living in a home or living in the space that's tested high that you shouldn't take action, because you also need to consider the fact that they've lived other places and they have been exposed likely in the past. So it's all cumulative. But certainly with young kids, we encourage action sooner rather than later. And then with regards to the radon level in the whole floor versus the one space, the one room that you tested in, typically on one floor, the radon levels are likely to be the same, unless there's different ventilation in the room for some reason. But ultimately, the only way to be sure of that would be to test the other rooms.
Wonderful. Thanks so much, Kelly.
Welcome.
Okay, that's all I have for health impact questions for the moment. So I think we'll just move right along to our next section. So our next presenter is Pam Workington. So she is project manager on the Take Action on Radon team and executive director of CNRPP, and she'll be talking about CNRPP during the next slides. Welcome, Pam.
Great, thanks so much, Erin. Yeah, so at this point, all of you should have received your radon test report either by email, mostly by email. We did mail out a couple people reports to those that don't have an email address. And we wanted to just highlight the report a little bit because we did get some questions about how to read the report. So it should have, we've kind of blanked out contact information for this one, but it should have information here about you and your address. And then your radon report is in this section of the page. And so I've just kind of blown it up a little bit because it is kind of small font. So you should have received a PDF attached to the email. One PDF is sort of how to interpret results, and then the other is this radon report. And the number here before the plus minus is your radon report. So if that number is above 200, then the recommendation, as Kelly has been saying, is that you should reduce your levels to as low as possible. And the higher the level, the sooner that you should take action. And so what kind of action can you take? Radon mitigation is the most effective way to reduce levels in your home. And so I've got kind of a couple simplified pictures on this screen just to help be able to understand it. But what radon mitigation system will do is it'll provide a pathway. So it looks a bit like a spare tire, but this is sort of just space under your slab. So it's to provide a pathway for the gas to go from under your home, the foundation of your home, up and out of the house. And so this is basically just the open space beneath your home. So the pipe will go down through your subslab space. The certified professional will dig a bit of a pit so that there's a little bit of an air gap under the concrete floor. And then they'll install a fan on the piping system so that it goes up. It draws the air through the piping system. And ideally, this would be properly sized for your home so that it's the smallest fan that can be installed while still working efficiently to remove the air from the full footprint of the house. So you can see in context here, ideally what we want is that it would be off on the side, probably in a maintenance room, but it would still be done in such a way that it could draw air from the full footprint of the home. And there is a national certification program. So CNRPP is our national certification program. We have trained professionals across the country. And so you can go on the cnrpp.ca website. There is a red box on the front that says find a professional. If you click on that, then it'll take you to this page. You'll want to select mitigation professional. And you can either select your province or you can put in your postal code and then a radius, a distance from your postal code. So it goes in 50, 100, and then 300 increments. And if you don't find a professional in 50, then increase the radius. We do have certified professionals across the country, but they are regional. And so you might need to broaden your scope a little bit, but they are used to traveling and grouping projects together to be able to help with servicing areas. And they also do disclose in their listing kind of what areas they'll be able to, or what they're willing to travel to. So some of them will have that listed as well. And then there's just a couple pictures. So when you do reach out to a certified professional, you can ask them for a quote and ask them for a little bit of what they're going to do. So they should, when they come to your home to start to install, they should do some pressure measurements. And so they should drill a small hole to be able to measure some air pressures beneath your slab. This is one example of a mitigation system that it looks like in one home. And then this is what, again, another example of what it looks like, the discharge pipe kind of coming out of the house. Here's another example. And so they can install this through a concrete floor. They don't need to dig up the whole floor. They just usually drill a 5-inch hole through the concrete floor, and then a couple small test holes in out of the way spots just to measure the airflow. If you have a crawl space, then they may install a membrane, so a plastic membrane in the crawl space before putting the piping in, so that they create that foundation and that seal as well. And so it is really effective. One of the questions we often get is about, how much does this cost? And it's a difficult thing to answer, because the cost is based more on the complicated sense of your home. But over the last 5 years up to about 2021, we had a contest that we ran, and we gathered data about costs. And so you can see in this table the regions across Canada, so you can kind of identify your region, the average cost, but then we also have the high and the low cost. So you can see that there is quite a range. And often we find in a home that does have a crawl space or more complicated architecture might be more expensive. And then some of the lower costs may be that they just did some simple measures, either as a start to reduce the levels. So like we see, the average is typically around about 3,000 that we're seeing across the country. And this was in 2021, so we have seen costs go up a little bit, but at least it gives you a little bit of a framework for that. Now, I know there was a question in the chat already, but about grants. So there is a national grant that is available for homeowners. So the Canadian Lung Association does have a radon mitigation grant, and it's called Lungs Matter. So if you just search online for radon mitigation grant, it should pop up in the listings. In order to qualify for it, you do need your radon test report. So the report that you received is participating in this project, you can submit. You also need to get a quote from a CNRPP professional. And so you can contact 1 or 2 CNRPP professionals and get a quote. You need to apply before you get the work started. And then you also need to qualify. And in order to qualify for the grant, you need to either be in the low to moderate income. So you need to be below the median income for your region, according to Stats Canada, or somebody in the home has a lung cancer diagnosis. So those are 2 ways that you can qualify. So you do need to submit confirmation. If you are qualifying based on income, you will need to submit your last year's tax assessment. So that form can all be entered online. So that's a national grant. If you're in the province of Ontario, there is a Terrian warranty that covers homes for the first 7 years. So if your home is still fairly new, less than 7 years old, you can claim on Terrian warranty your radon mitigation. So you can touch base with them on how to claim that. And then also there is now a provincial grant in Nova Scotia. And so similar to the national grant, but it is $2,500 grant. And so if you are in the province of Nova Scotia, then you can apply through the provincial grant through Lungs Nova Scotia PEI there as well. All right, and so that's a little bit of information about reducing your radon levels.
Wonderful. Thanks so much, Pam. So we do have a lot of questions on this topic, which makes sense given the audience that we reached out to for this presentation. So I'll just jump right into them. First is quite a general one. What do I need to know when I ask for a quote from a mitigation professional?
So there is a list of questions on the CNRPP website, but we do encourage you to ask questions. You're hiring a contractor and you do want to be comfortable with the person that you hire. So you can ask them questions such as references. Do they have references for work that they've done in the past? What to expect when they come to your home? What type of work will they do? And so they should say things like they will do some testing to size the fan. They'll do some diagnostics, or sometimes they call it a pressure field extension test. They should also talk about time frames. So you might want to ask them how long it would take. And they should ask you a little bit about your home. So some of the features of the house, because as I mentioned before, it is based on, the types of things that are in your home, such as a crawl space, a sump pit, things like that. And then another question to ask is to confirm that they have insurance. So all CNRPP professionals should have, it's mandatory that they should have insurance. So you can, confirm that. And you can ask them, they should have a CNRPP number. So you can ask them for that as well.
Great. Okay, how will adding a mitigation system impact the sale of a house?
Yeah, this is quite a common question that we get. So in some provinces, there is a question on the property disclosure statement about radon. And so with a radon mitigation system, you can put on the fact that you do have it. So you've tested and you've already reduced your radon in your home. So now that provides you with a benefit to the fact that not only do you know, but you've fixed it. Once you have hired a professional or you've reduced your radon, you should do another test. So you should do a follow-up test to make sure that the system has worked and efficiently is reducing levels. And so you can keep that report to show that your levels are quite low. And so it really is showing that your home is a healthy home and that you have done something to help that.
Great. Okay, two more sort of technical questions. One is, some people have noticed from the diagram that it looks like a fairly simple system. Is this something people can do themselves?
It's possible. So we don't know what your abilities are. There is a national standard. So we do recommend a few things to keep in mind if you are doing the work yourself. One is that the clearances, so there is proper clearances when you discharge out of the house to make sure that it's not too close to windows or things that can come back in. It does need to be properly sized, so we want to make sure that the fan is the appropriate size for your house. You don't want to just put a big fan on that could be oversized and it could draw too much air from the slab. And then also you want to make sure that it's properly sealed. So the cracks and openings to the slab should be properly sealed, and that's one of the things that they'll CNRPP professional will take quite a bit of time to take a look at and address. Because if the foundation isn't properly sealed, you can actually be drawing your conditioned air down through the foundation and then up now through the system. And you don't want to waste that conditioned air as well. If you've got appliances in your home, such as gas-powered appliances or wood stoves, you can actually be backdrafting them. So you really want to be cautious of that. And then when you are installing it, you're sort of opening up a hole. So you want to make sure you ventilate the house while you are doing any work where you open up the house to your foundation, because you're kind of could be drawing more radon in. So you do also want to make sure that you're cautious when you're doing that as well.
Great, thanks, Pam. So that's all in reference to what we call a standard mitigation system, like a sub-slab depressurization system. And so we've received a question, what's the difference between installing an air exchanger versus that radon mitigation system?
Yeah, okay, really good question. So there are many homes that already have an air exchanger, either an HRV, which is a heat recovery ventilator, or an ERV, an energy recovery ventilator. So you may have something like this already in your home. And this provides dilution of the air. So it brings in air from the outside, so fresh air, and it takes conditioned air out, and it does it hopefully in such a way that it's sort of recovering the heat in the air. Now, this doesn't prevent the radon from coming in. So a radon mitigation system actually provides that pathway for it to kind of go right from the source and be discharged outside. So so that's one benefit of radon mitigation versus the heat recovery ventilator. It also isn't quite as effective, so it's diluting the air, so it has a percentage of reduction. And so we're seeing levels like maybe 30% reduction with the ventilation, where with the radon mitigation system, we're seeing levels such as 80 to 90% reduction. So much more effective reduction as well in the radon mitigation system. But I will say, if your home already has a ventilator in it, an HRV or an ERV, then you may want to check to see that it's balanced. So these should be regularly maintained and balanced, because the air comes into our homes because of the change of pressure. And these systems can cause the interior of our homes to be at much less pressure than the basement, and so they can sort of get our homes out of balance. And so if the system isn't properly maintained and cleaned, it can be drawing air out of the house at a higher rate than it's allowing the air to come in, which means it's sort of creating a depressurization, and it could be actually increasing your radon level. So you might want to look and get that balanced, and then test again, or purchase a digital radon monitor that could help you with ongoing testing. Really, if you do have an HRV in the house, we do recommend that you just have an ongoing test so that you're continually monitoring your radon, and that will help if it starts to get out of balance. You'll see if the radon levels start to rise.
Great, thanks very much, Pam. We do have, we can make available to you some sheets that explain this. Pam just covered a lot of ground, but if you dig around on our websites, we do dig into that as well. So if you're more of a visual person, you can see some images and stuff about the HRVs. Okay, another question that is multi-step, Pam, for you. So we'll walk through it. So our radon test result was above 600. When I was talking to someone from the Lung Association to get information about radon, she explained that radon does not stay the same at the same level throughout the year, and it could be lower in the summer than it was in the winter. Could you please explain why this happens? If it's in the ground, wouldn't it be the same through the winter months just as during the summer months? And then there's additional questions, but I'll let you jump on that one first.
Sure, yeah. So typically, the radon levels are higher in the winter months, and this is for a couple reasons. One is, as I mentioned before, the air comes in, so radon is found in the soil, and it comes into your home because the air inside our home is naturally at a lower pressure than the air in the ground below it. So it just naturally kind of draws it in. Now, there are things that can increase this pressure difference and have the radon draw in, more radon come in, or be drawn in faster. One is, like I said earlier, about an HRV. If the system gets out of balance and creates a higher depressurization in the home, then that can draw more air in. But the other could be weather. So if it's colder outside and your house is nice and warm, such as our winter here in Canada, then the temperature difference can also create that greater pressure difference, which can mean that more radon is coming in from the soil than during the summer when the temperature difference isn't as great. Now, this can also be that in the winters your windows are closed, and so the windows do provide good ventilation, so it can be lower in the summer as well because of that. Now, there are some homes that are consistent. Sometimes it is a little bit different, but that's typically what we're seeing, is that it is higher levels in the winter than in the summer.
Great, thanks very much. So then, as a secondary to that, so this person again did have quite high levels. Is there anything I can do to keep radon from coming to the house while they wait for the mitigator to come and complete the mitigation? He says to keep a window open downstairs. Is there anything else I could do?
Yeah, so there is, like opening a window downstairs is a great idea. And specifically, the reason that they talk about downstairs is because that is where the source is of the radon. And just depending on your home and the building envelope, if you only were to open a window on an upper floor of the house, it could actually sort of create a pathway so that it helps to draw more radon in from ground. So that's why we talk about open a basement window, because then it actually provides ventilation instead of creating sort of a different type of stack effect or draw from the ground. So yeah, that was definitely one way. Another is to seal up your sump pit. So if you've got openings in the soil, such as a sump pit, or sometimes you just have like random openings. So I know in my home I had a square, opening in my concrete floor that was open to the ground. So you could just put, a poly cover over it, a piece of plastic sheeting, and tape it up until the mitigator can come and do a permanent job for it. The same with the sump pit, you could kind of cover up the sump pit. But that's something I would specifically ask the certified professional, the CNRPP professional, to help you with guidance, because they can provide you some insight as well in that. Was there
Okay.
one more question in that I missed?
No, that was adequate. That was an adequate answer to that. So then I've got a few that are technical or specific features of somebody's house in particular. So I would just say, generally it's case by case when you have, like a specific technical question or some unique feature in your home that you're wondering about, how would this get addressed? Or how would that get addressed? So Pam, were there any main things to bear in mind as a homeowner goes forward with that?
Yeah, so I think just understanding that there are different housing features across the country that do make systems more specific for your house. And so this is why, again, we try and talk in generalities so that you understand what's going into a radon mitigation system. But a CNRPP professional should be able to help you with answering things specific for your house. Things such as sump pits are common areas that we are seeing radon coming in because there are specific openings to the ground. According to the building code, these sump pits should have an airtight seal on them. So that may be one area that they want to address. And so sealing up a sump pit so that it's airtight to your home will not impact the way that the sump pit works. It will it might be that in the spring you need to open it, and ideally if you can get a seal that has a bit of a window on it so you can still monitor your sump pit to make sure it's working, that's fine. But you might need to have something that you can kind of take a look at your sump pit and then be able to reseal again once you've checked to make sure your sump pit is working in the spring. Other things, there are other funny building features that we do have across the country that may impact how effective these systems can work. And that really is why we defer to the certified professionals to give you advice on the different features. Sometimes they may call in a subcontractor to help with different features. I guess a crawl space is another major feature that they may want to deal with. So that has a good membrane on it. Often these plastic membranes get ripped through the years and they're quite thin, so they may install a thicker membrane to make sure that they can get a good airtight seal. Yeah, and then there is different features that draw air in from outside your foundation. And those two, they want to make sure that they're sealed up in such a way that they're just drawing air from under your home. They don't want to draw fresh air from outside. So there may be different features that are installed in our homes and in the subslab space that do impact. And so they need to seal off French drains or things like that may draw air from outside the perimeter of your home when really they're intended to draw water from under the perimeter of your home. So they can still do that, but be fixed up in such a way that they're not overdrawing air.
Okay. That's great. I think we'll move on to Anne-Marie's section. We're getting a good number of comments and questions, and maybe if we have room for a couple more at the end, but I don't want to shortchange Dr. Nicol. So we'll move on now. Dr. Anne-Marie Nicol is with BC CDC. and she'll be speaking about some of the other initiatives that are going on in the world of radon across the country. So welcome, Dr. Nicol.
Thanks, Erin. Next slide, please. So, hello to everyone. And today I'm going to talk a bit about radon mapping, some other initiatives that we've started here in BC, and a bit about radon in schools. So first off, just to let people know that in different provinces across the country, there are different types of radon maps. And these are used by policymakers and providers and researchers just to better understand radon distributions within provinces, which could be useful for things like building code changes or municipal bylaws. In BC, we have what's known as the BC Radon Data Repository. And what's unique about this resource is that it is situated within the provincial government under PHSA. And that allows people to access it anonymously to do research. So we can do linked case control studies and other sort of powerful epidemiologic studies. And the more data that we have, the more power the researchers have to understand things like potentially cancer signals and tumors that might indicate radiation exposure. So the BCCDC Radon Data Repository, I apologize for all the acronyms. It integrates anonymized data that has been done from radon testing of individuals' homes or buildings done by government, industry, the nonprofit sector, and academic researchers. And it is a very popular tool. It has been designed so that people can use it on their smartphones. We know that realtors use it a lot to have discussions with their clients about radon, but it's not alone in the rest of the country. So next slide, please. The Quebec Lung Association also has a fantastic mapping resource. This is by what I would call a health authority. Erin, you might have another word for that en français.
Well, administrative region, yeah.
Okay. And then Nova Scotia also has a map from, I believe it's the Department of Natural Resources and Renewables. And the Yukon it does have a map. It's being updated at this moment in time. And that's also available, but for just the region of Whitehorse, or also for the whole territory. Next, please. The CNRPP, so the organization that Pam was speaking of before, also has a map of radon results that mitigators provide, and that is a national map. And then Health Canada did do a cross-sectional survey of different regions across the country, weighted on population. And they have taken the data from that. That was done in the late 2000s to early 2010s. And that data has now been provided in a map. It's publicly accessible, and people can go to this web link and search through it as well. The CNRPP, you can also type in your postal code on that, and it will fly you around to different regions, and you can look at the levels. And what's really clear is that even though we are showing that there are areas across the country where radon levels tend to be higher, there are very few to almost no regions in the country where there aren't at least some elevated levels. And that's one of the messages that's really we need to keep coming back to when we're showing people maps, is just because your area is lower doesn't mean it's radon free, and it's still very important for people to test. But knowing levels is important, and this is part of what I'm going to speak of, I believe, in the next slide. So here in BC, we have started the first pilot of a low-dose CT screen that includes people who have been exposed to radon. So across the country, different provinces are scaling up low-dose CT screening for lung cancer. And as Kelly mentioned in the beginning, lung cancer continues to be a significant health threat in Canada. It is the leading cause of cancer death, lung cancer, and it's In total, over 20,000 deaths per year. So that's about 22 people a day. And again, a significant proportion of that, almost 16 to 17%, is related to radon alone, and likely more from the co-exposures of radon and tobacco smoking. And early diagnosis does continue to be really the main variable that keeps people alive after 5 years. And an X-ray really is not an ideal screening tool. And so now in some provinces, if you're a smoker, you're able to access low-dose CT screening. But BC is the first province to actually allow people to get a lung screen if your home is above 800 becquerels per meters cubed and you've lived in it for more than three years or more, and you are a non-smoker. So the information that we learn from this pilot will be very interesting to the other provinces that have low-dose CT screening programs, and it may widen the eligibility. We often have people email us and ask us what can they do if their homes test high. It's important to talk to your doctor and let them know that you do live in a home that has had elevated radon in it, because you can make some decisions about the kinds of screening tests that you may need going forward. And if you are interested, the recruitment, just if you want to go back, Erin, the recruitment information for that study is there on the bottom of this slide. So this is a BC Cancer Initiative, and this will run for approximately 1 year. So up until 2025. Next slide, please. In BC and now more broadly, we've been studying the impact of renovations, particularly energy efficiency renovations, on radon levels. So any home that has a renovation done to it means that there's going to be a change. And often those changes can impact airflows. People can upgrade kitchens and add more powerful exhaust fans, or they can finish their basement. Or in the case of energy efficiency, we know that people can even DIY things like putting in new windows and doors and sealing cracks. But it's very clear from research that was started in the 1980s that efforts that are taken to seal up homes also keep gases in, not just radon, but other kinds of gases. CO2, for example, is one that's fairly well known. So what can you do about this? Right now, across the country, there's both education and collaboration to deal with energy efficiency advisors and other organizations that are promoting energy efficiency, to also promote the fact that you can be good for the environment and helping the planet, but also making sure that your health is looked after too when you're doing renovations. And we're really encouraging people, after really any renovation, to test your home for radon, even if it was low. Before you put in the energy retrofit, it's actually quite striking that even simple strategies like sealing up windows and doors can actually change radon levels. So there's now a national Canadian working group addressing this. We're developing education for energy advisors so they can talk to people about the need to test for radon after a retrofit. And there's ongoing studies of Canadian homes. Next, please. Another question we get a lot is, have schools been tested? And there is no consistent policy across the country for school testing. We know that some provinces have tested more schools than not, although some of that testing was done quite some time ago and may not include new schools. So one of the best things that people can do is talk to people in their school district as to whether or not schools have been tested. We know that schools are important buildings for students because they spend a considerable amount of time there during the day, but also teachers. Some teachers will work in the same school for most of their life, and often these are ground contact rooms, so they're spaces that we know that radon can accumulate, and so testing of schools is important both for children and for school staff. Okay. Any questions there?
Thank you, Dr. Nickel. Yes, we have a couple of questions in sort of other radon initiative area. So one of them is, I have tested and fixed my house. Are there other things I can do to help get more people to know about radon?
I think there's lots that people can do. I think once you test and fix your home, you really have become a radon ambassador in a way, and spreading the information to people in your community, other family members. It's encouraging people to take on what we call the 100 Test Kit Challenge in other communities. We call it a challenge because we want people to know, we want them to challenge their neighbors and their friends to test as well. So once you know about radon, you can really help spread the word. It still remains one of the least appreciated lung carcinogens. And it never ceases to amaze me in my work that I go out and talk to people who, very well-educated people who still don't know what radon is. So you're doing your part by talking it up and sharing your experience with other people.
Great. How can people know if their children's school has been tested for radon?
Yeah, I get that question quite a bit. I really encourage parents, especially in elementary schools where we know they tend to be smaller buildings or with basement classrooms, to either talk to the principal or ask the school board if the school has been tested, and then ask if it's been remediated. Because it's one thing to know the level, but it's better if they've fixed if the level is above the 200 level guideline. So public buildings and homes have the same becquerel per meter cubed limit of 200. So you can ask at the school if they tell you what is radon. Now you have an opportunity to educate people about what radon is as well. You can also ask a teacher, but likely the teacher doesn't have a jurisdiction over the school. So it's probably a good question for the principal or whoever does the health and safety of the building.
Another question, are there any tax credits for radon testing or mitigation?
There is one tax credit if you're a person who works from home or you do remote working. You are able to access a CRA tax credit for testing your house. And that can include the testing device, or you can hire a professional to come and test. So that's the Canadian Revenue Agency does have a tax credit for people who work from home or have a home office.
Wonderful. Thanks very much. Okay, that brings us to the end of the questions that I can see on my screens. Pam, do you want to jump back in, or are there any other? There's one other question that's kind of more your bailiwick, and then I'm not sure if you have other questions you'd like to address.
Yeah, I think there was one question that I addressed in the Q&A or the chat about windows. So we did talk about opening windows as a temporary measure while you're waiting for someone to come and hire them to come and fix. Now, could you use that as a permanent measure? Well, I suppose you could, but we in Canada, we tend to, it's not always the most efficient measure to have a window open constantly. And so it might not be a year-round solution. And then also, still, you would want to monitor it because it's an uncontrolled system. Again, it's ventilation. So if you're using your open windows in a way to control your radon levels, then you would probably want to purchase a digital monitor so that you could continually measure what your radon levels are so that you know if it's being effective. Because again, I mean, depending on how the wind blows or depending on which window you open, it might change in the effectiveness.
Yeah, I just wanted to add also that while it might be really effective in the summer, not only is it colder in the winter in most parts of Canada, but the stack effect inside your house will be stronger. That's what Pam was talking about, that warm air sucking basically effectively on the ground under your home. So the effect that you get, the dilution effect that you get from a window could overall be less because there'll just be all those additional forces bringing radon into your home. There was a general question that we had received. We did cover it in our presentation, but it's probably good just to drive the point home. I'm looking for information on businesses locally who can come into our home and improve our radon levels. Where can people go for that?
Yeah, so we do have a list online at cnrpp.ca. And so I think we did send it out in the chat, and then I did, in the email, and then I just put it in the chat, or you can just type it into your browser, cnrpp.ca. No, I put the wrong link in the chat. There. So if you go there, then you can find a list of professionals that click on the Find a Professional link. Most of the communities that we worked with across the country, we did reach out to make sure that there were people that either were in the area or willing to travel to the area. So if you are having a hard time finding one, you can also reach out to us and we can help connect you with somebody. I do also want to just address, there was a homeowner that a couple of weeks ago sent a question in about the contractor was breaking up their basement and doing different work so there is a national building code for radon, and that's for new construction. And it involves putting in pipe under the concrete floor that leads towards the center of the house, and then having a rough-in, or if you're in BC, then it would be an extended rough-in in the house. And the question was about the contractor was installing that in an existing building. So they were basically breaking up the whole concrete floor to install this. And that is not the way that we recommend installing a radon mitigation system in an existing home. It's basically because you're in new construction, it's part of new construction because we want it ideal when you're just building a house. But in an existing construction, a CNRPP professional can drill some really small holes and do some air pressure measurements to determine what's going to be effective for your house. So I would raise a red flag if the contractor is going to chop up your concrete floor, then ask some more questions, because that is it's unusual. It's not typical practice.
Definitely. Okay, well, we're a couple of minutes early, but that's never really a bad thing. Oh, right, last slide. So not really early. So all of you had participated in this year's 100 Radon Test Kit Challenge, and we are excited to be announcing that we are starting to release the community reports. So you've all received your individual confidential radon report, but what we then do is we combine everybody's data for each community and we prepare these community reports. We publish them on our website on takeactiononradon.ca. You can see the direct link down at the bottom of the screen there, and of course we'll be sending this out to you. So these are only ready once we've had a series of meetings, generally with your community liaison. Often the mayor and council has been consulted, and so it's really a team effort, and we really salute these communities who have taken on this radon testing program in addition to all of you. So you can see that so far we've released them for Lumbee and Vanderhoof, Dauphin, Manitoba, North Kawartha, and Conception Bay, South Newfoundland. So we'll be publishing more and more of these throughout the coming weeks and months. And all of them, in addition to all the reports for all the communities who participated over the past 5 years of this program, are available if you feel like looking around and seeing how different communities compare. Those will all be getting added to our website coming up. So yeah, huge thank you to all of you for attending. Thank you so much to Pam and Kelly and Dr. Anne-Marie for joining us today and sharing their expertise. And one final note, if you have questions in the weeks and the months to come, don't hesitate to reach out. We have easy ways to get a hold of us at Take Action on Radon or at CNRPP or even Health Canada. There are regional radiation specialists in each region. And this is what we're here for. We're here to answer these questions, whether it's tomorrow or months from now. So please never hesitate. We're here to support you. Okay, thanks very much. Bye-bye.
Great, thanks all for joining.
everyone.
Thank you.
Bye.